Welcome back, everybody. So let us go through these set of questions in pathology. 82-year-old woman with Alzheimer's disease dies out of congestive heart failure. The brain at the autopsy, what does it exemplify? Typically, it is showing atrophy. This brain is showing atrophy. If this is the normal brain, this is a cortical atrophy that you typically see in case of Alzheimer's disease is what you need to remember. So atrophy is the diminution in the size, diminution in the function of the organ. In Alzheimer's, there is a extensive cell death. So the size of the organ cannot be restored. The gyri become thinned and the sulci become widened. As what you can see, the gyri become thinned and sulci become widened. These are the sulci. They become widened. That's how you identify the presence of cortical atrophy in case of Alzheimer's disease is what you need to remember. A 65-year-old man suffers a heart attack and expires. Good to see 11 online. Please inform your classmates that the session restarted. He suffers heart attack and expires. And the lungs at autopsy show numerous pigmented nodules, as what you can see here, scattered throughout the parenchyma. Good to see Prasoon Vaidya, Pradeep Reddy and many more who are all online. So nowadays, YouTube, there are quite a few challenges because they are also working with a very limited staff, the YouTube. So that is the reason to upload the videos, to do the live streaming, there are certain issues, but we need to manage those issues in this limited resourceful time. Now, what is a diagnosis? Where you are able to find numerous pigmented nodules scattered. It is a case of anthracosis. The carbon particles, when they become stored in the lung and regional lymph nodes and accumulate inside the alveolar macrophages, you call it as anthracosis. Good to see lovely Dubey and many more who are all online. Now, sometimes the workers who mine, who do the mining in the hard coal, that is anthracite, typically they develop pulmonary fibrosis because of the presence of the toxic and fibrogenic dust like silica. And this type of pneumoconiosis is called as anthracosilicosis, is what you have to emphatically remember. A bone marrow smear. Good to see Kochi Machan. Kochi Machan is from which part of Kerala, doctor? Bone marrow smear in a person who is at high altitude is being shown to you. So, what are you able to see in this? The erythroid cells typically have undergone increase in number. So this is an example of hyperplasia. Those people who are staying in high altitudes, they produce a lot of erythropoietin. and that lead to development of the hyperplasia of the bone marrow is what you need to remember. Now, hyperplasia is the increase in the number of cells. So whenever there is polycythemia, how do you divide polycythemia, doctor? It's called primary polycythemia, also called polycythemia rubra vera. The problem is in the bone marrow. The bone marrow, without the need of any erythropoietin, excessively is producing RBCs. That is called primary polycythemia. Fundamentally, it is a malignant transformation in the bone marrow directly. So that even without the need of erythropoietin, in fact, erythropoietin is low in primary polycythemia, which is also called polycythemia rubra vera. It is because of the JAK kinase mutations that lead to primary polycythemia. Whereas those who have cyanotic heart disease, those who live at high altitudes, those who are smokers, those who have COPD, they all have a high erythropoietin leading to secondary polycythemia. So whatever it is, in secondary polycythemia, when erythropoietin is very high, that stimulates the bone marrow, and the erythroid precursors in the bone marrow undergo a hyperplastic change, is what you need to remember. Maternal hyperglycemia during pregnancy. The pancreatic islets in the neonate who is born to the 36-year-old women with poorly controlled diabetes. What do you expect in a newborn? What happens to the pancreatic islets because of the maternal hyperglycemia? Maternal hyperglycemia stimulates the fetal pancreas to overproduce insulin. For that, the islet cells undergo hyperplasia. Increase in number is what you need to remember. So what is the definition of metaplasia, doctor? Conversion of one differentiated cell into another differentiated cell. Both of them are differentiated only. Nothing is de-differentiated. Then you basically call it as metaplasia. Metaplasia. Pradeep Reddy rightly tells that if the mother has diabetes and the newborn baby born to her has a high risk of developing hypoglycemia. What is the reason? When the fetus is inside the mother's womb, then the maternal hyperglycemia, because mother has diabetes, so mother has diabetes. So the maternal hyperglycemia will lead to fetal pancreatic islet cell hyperplasia to happen. So fetal pancreas is overproducing insulin in response to maternal hyperglycemia. So that leads to a hyperinsulinemic state in the fetus. The moment fetus is born into this competitive world, where you have USMLE, you have many licensing exams to pass, how is the fetus of how is a newborn whose mother is diabetic? That newborn is having hyperinsulinemia. And suddenly it will go into hypoglycemia. So hypoglycemia is one of the complications in a newborn born to the mother who has diabetes, because the maternal diabetes lead to fetal hyperinsulinemia, and that lead to development of neonatal hypoglycemia when the baby is born, is what you need to remember. A 58-year-old chronic alcoholic presents with severe abdominal pain. The pain radiates to the back, and there's exquisite tenderness. If he lies down, more pain. If he sits and leans forward, less pain. So that is very, very, very classical of pancreatitis. So this is the edematous pancreas with peripancreatic necrosis in acute pancreatitis. What is the consequence of that? What type of necrosis is it called as? Typically in pancreatitis, there is a huge elevation of lipase. Because of that lipase elevation that lead to development of fat necrosis is what you have to emphatically remember. So this is how a pancreas will show typically a saponification of the momentum and the mesentery. There is a saponification because of all those lipases. Saponification typically develops. This is the histology of the normal pancreas. This is all that inflammatory infiltrate, and this is that enzymatic fat necrosis that you are able to see, and this is the vessel with the necrotic walls, a typical histology of saponification because of excess lipases in case of pancreatitis is what you have to remember. So whenever there is a mild acute pancreatitis, there will be interstitial acute inflammation and spotty peripancreatic fatty necrosis. Whenever it is a severe acute pancreatitis, there is abundant neutrophils, large areas of fat necrosis, saponification. So these are all the features that you see when there is a severe acute pancreatitis is what you need to remember. Now, a 59-year-old female alcoholic is brought to the emergency with a fever and foul-smelling breath. The patient develops bronchopneumonia. You have done the autopsy. What are you seeing in autopsy, doctor? You are seeing multiple lung abscesses. Now the examiner's question is, what type of necrosis do you see in the case of the lung? Is a very, very important question. It is liquefactive necrosis. Whenever the rate of dissolution of the necrotic cells is very fast than the rate of the repair, then that leads to liquefactive necrosis. The polymorphonuclear leukocytes of the anti-inflammatory reaction release a lot of hydrolases that will digest all the dead cells, and typically that leads to development of liquefactive necrosis. Caseous necrosis is seen in necrotizing granulomas like TB, tuberculosis. Coagulative necrosis, what is the characteristic feature, doctor? The cell outline is retained. The cell outline is retained. So that is the story. A 62-year-old man with the history of gastroesophageal reflux. Esophagus at autopsy is being shown to you. The histology of it, and you can also see the pinkish colored Barrett's esophagus. So Barrett's esophagus represents which type of metaplasia is the examiner's question. I'm so happy to see 41 online students. Thanks for joining this session, doctor. 20 years back when I started coaching program, those days we recorded the video lectures. There used to be 70 centers across India. and we used to put a LCD projector and run the video. Those days everyone was saying, "Hey man, are you crazy?" I said, yes, my knowledge should not get wasted. It should become rapidly multiplied across the country. Those days, internet is not available. Way back in 2000, not this much available. Later on, we came up with hosting it as an online video library about 10 years back, 1 decade back. Once more, we are the first to do that. And students across various parts of the country, they used to get the DVDs of the videos in encrypted form and also used to watch the video library. And we are the first in the country about 7 years back to start live online broadcasted session. Those days YouTube is not available like this. We used to use something called live stream. So once more we are the first to innovate, and thanks to the students who were adopting, early adopters. Then people were a bit skeptic. Oh, how will be live online? Oh, will that be interesting like face to face and all that? But we have proven that live online interactive session is the most comfortable thing, because you can sit in the home and can be able to chat with the teacher, chat with the classmates. Today, Corona once more has made it a proven fact that telemedicine is okay, telelearning is okay, online live class, anywhere, anytime, affordable, accessible is the best. So, I like to tell you, Doctor, 102 years back also we had a flu that wiped out 1/4 of world population. Today Corona, but luckily we have better awareness, better social media and live online interactive sessions. Everything makes life not that miserable what it was about 104 years back, when even father of nation Mahatma Gandhi ji also was affected by the Spanish flu. People thought, will he survive or not? Coincidentally, Mahatma Gandhi ji was also 46-year-old. I was just, while reading the article, I thought, oh, 104 years back, Gandhi ji was also of the same age as what I am today. But how lucky I am that I am able to reach the people on the YouTube with this live broadcasted sessions. So thank you all for joining the sessions. Please enjoy every day spending time with Dr. Murali Bharadwaj to discuss 50 to 60 questions and be confident. And once more, I like to tell all of you, Doctor, that please don't forget, you have www.onlinembbs.com. In the onlinembbs.com, you have 3,000 video lectures, 30,000 MCQs, 30,000 MCQs discussed, and 2 lakh PowerPoint slides are made available, and all these sessions are archived and made available. All these videos every day that we discuss, after the discussion we remove from YouTube and then make it archived into the onlinembbs.com. If you want concepts, you have the theory topic-wise review of 650 high-yield topics. There are 30,000 MCQs. Topic-wise MCQ-based discussion is available. You have around 200 full-scale grand test and discussion of nearly about 45 to 50,000 questions. And whatever now we are discussing, it is made available in a folder called USMLE Step 1 Coaching. So in this folder, all these videos will become archived. So take every chance to be subscribe to onlinembbs.com. Also, please popularize it among your classmates. And you don't need anything else in this world. You have everything available over here. So, doctor, this is a classical example of Barrett's esophagus. Barrett's esophagus is a glandular metaplasia, is what you need to emphatically remember. So, abnormal tissue shows intestine-like epithelium composed of goblet cells and surface cells similar to those of incompletely intestinalized gastric mucosa. So that is the typical glandular metaplasia of Barrett's esophagus, is what you need to remember. So in the Barrett's you have, how does Barrett look like? Salmon pink velvety mucosa adjacent to the gastric mucosa, and it has got irregular margins, and it contains islands of the residual squamous pearly white esophageal mucosa, and it is usually limited to lower 1/3 of the esophagus, is what you have to remember. So where do you see squamous metaplasia? Squamous metaplasia occurs in bronchial epithelium in the people who do the smoking. 32-year-old man presented with palpable purpurae. Histological examination. What do you expect? What type of necrosis? So you should remember, whenever there is a necrotizing vasculitis, it leads to development of fibrinoid necrosis, is the classical feature. So hypersensitivity vasculitis, otherwise called allergic vasculitis, commonly because of the drugs, penicillins, sulfonamides, thiazide diuretics are also implicated. So whenever you give thiazide or sulfonamide or penicillin, when the patient develops a skin vasculitis with palpable purpurae, which are vasculitic purpurae, then that is also called allergic hypersensitivity vasculitis, called leukocytoclastic vasculitis. So what are the criteria, doctor, to diagnose this? Age more than 16, a triggering drug, palpable purpura, maculopapillar rash, and the skin biopsy will show neutrophils around the vessel, and the fibrinoid necrosis is the classical feature in case of necrotizing vasculitis. Nowadays, all licensure exams across the world, whether you take India or Philippines, Caribbean islands, Pakistan, Bangladesh, USMLE, any exam today is all image-based, clinical-based, clinical vignette-based, practical questions to test the knowledge of you in an applied scenario. So that is the reason you should get abundance of the practice. So a CT scan in the next 18 days of the lockdown, we are going to do the revision of 3,000 USMLE Step 1 styled clinical vignette based questions in about 150 to 200 hours to come. So please stay tuned with us, and be also subscribe to onlinembbs.com video library, and for a throwaway price you get an access. You can call 9000-868-356 to take the subscription. So a CT scan of 54-year-old women with parathyroid adenoma. Always, what is the rule, doctor? Hyperparathyroidism is synonymous with hypercalcemia. Hypoparathyroidism is synonymous with hypocalcemia. So whenever there is a hypercalcemia because of the hyperparathyroidism, then metastatic calcification occur into the lungs, as what you can see. Metastatic calcification typically occur into the lungs. Then what is the meaning of dystrophic calcification? Suppose if there is any tissue damage due to whatever the pathology, into the damaged tissue, if the calcium comes and deposits, it's called dystrophic calcification. Whereas if the calcium levels increase and that increased calcium goes and deposits, that is called metastatic calcification. That is what you need to remember. So another classical example of metastatic calcification. Whenever vitamin D toxicity is there, then excess calcium. Whenever hypervitaminosis D is there, excess calcification lead to opacity in the cornea. Similarly, whenever the breast cancer metastatic to bone, it will lead to osteolysis and release a lot of calcium, and that calcium goes and deposits in the alveolar septa in the lungs, is what you need to remember. So what is an example of dystrophic calcification? If there is any arteriosclerosis, typically an elderly person who has arteriosclerosis, there is a deposition of the calcium. If you happen to do a CT scan in an elderly man, you can see the coronaries virtually. If this is the coronary vessel, you can see the calcium deposited into the coronary wall. Is an example of a dystrophic calcification. Can you use the CT angiogram to discover the coronary stenosis? High resolution CT. You can do that only in younger people, not in elderly people, because in elderly people, due to the senility, they have arteriosclerosis and there is a calcification in their vessels, coronaries. So it's very difficult to interpret whether there is a stenosis in elderly person using a non-invasive CT angiography. Whereas in the case of the younger people, yes, non-invasive CT angiography is a good option, alternative option to doing the regular conventional coronary angiography. So that's a point you need to appreciate. A 24-year-old man from India, persistent cough, night sweats, low-grade fever, general malaise, and the sputum is showing acid-fast bacilli. Now you can see that there is a hilar lymphadenopathy. Subpleurally, there is a focus. What is this combination called as? Hilar lymphadenopathy with subpleural focus in TB. This is called as Ghon's focus. It's called Ghon's focus in tuberculosis. So if you check the lymph node, typically tuberculosis lead to caseous necrosis is what you need to remember. So you should remember, doctor, that typically the Ghon's focus is subpleural focus along with hilar lymph node. That is Ghon's. Whereas if there is any cavity formation or a apical fibrosis, that is secondary. Whereas Ghon's focus is an example of primary tuberculosis. So subpleural granuloma involving lower part of the upper lobe or the upper part of the lower lobe with a ipsilaterally enlarged hilar lymph nodes is basically called the Ghon's complex. Whereas secondary TB typically occur apically in the form of fibrosis. Whatever it is, caseous necrosis is the characteristic of TB. A 68-year-old woman with a history of heavy smoking, repeated bouts of pneumonia, chest X-ray shows a right lower lobar infiltrate. A transbronchial biopsy has been shown to you. So what are you able to see in this biopsy? Himanshu Mehta gives a good love letter. Hello, sir. I always see your notification. I want to thank you from the bottom of the heart for helping all the MBBS students and doctors. Sada mi sevalo. Always spending time with you all guys is the happiest thing that Dr. Murali Bharadwaj takes it very dear to the heart. Today we have 50 online students. It's like earning $1 million prize for Dr. Murali. So thanks for coming to this session, Doctor. We have no other work, whether there is a coronavirus or no coronavirus, without spending a couple of hours with all you guys. We don't feel like sleeping also, right? So, because some of you are going to be top cardiologists, neurologists, nephrologists, surgeons, neurosurgeons. In the last 20 years, I have seen 200,000 medical students. There are thousands of students who send me, said, we have not taken any coaching at all. Just we followed your YouTube on free videos and then cracked the top rank. I always feel very proud when I listen such things. Of course, we are commercial because we have the online MBBS.com video library. We allow you to buy the subscription and take the weekly full-scale grand test discussions, and you have 3,000 hours video lectures to do the revision. You have 2 lakh PowerPoint slides of notes. We want you to use them. So please don't forget, and also tell your friends, onlinembbs.com is the best place for you. Most affordable, at a throwaway price, you get an access to the entire video library, right? So please do promote it among your classmates. I'm so happy every day, so many are registering. So in the home page of the onlinembbs.com, you have a subscription form, Doctor. A quick subscription form. You can fill the subscription form in the home page, and this is the subscription form. You can fill this, and then you can be able to download PDF. Every day we keep a new PDF, so you can tell your friends to fill that form to get the free download of the PDF, right? And be part of our cohort. So, Doctor, what you are seeing here basically is an abnormal pattern of cellular maturation. So, whenever we say dysplasia, dysplasia is a deranged cell proliferation. There will be variation in size and shape. There will be enlargement, irregularity, hyperchromatism, disorderly arrangement. So dysplasia of the bronchial epithelium typically happen when they are constantly exposed to the carcinogens that you find in the tobacco smoke, is what you need to remember. So generally, invasiveness is equal to malignancy. So that's a point you need to appreciate. A 36-year-old woman complains of increased vaginal discharge of 1 month duration. The cervical pap smear is being shown. So you are able to see the cervical pap smear. So what is the change that you are seeing in this epithelial cells in this pap smear typically? So what you are seeing is called pycnosis. Pycnosis. So, doctor, whenever there is a coagulative necrosis, whenever you stain it with hematoxylin and diosine, the cytoplasm of a necrotic cell becomes eosinophilic. The nucleus displays an initial clumping of chromatin followed by the redistribution along the nuclear membrane. Clumping of the chromatin with the redistribution along the nuclear membrane, which is basically called pycnosis. In the pycnosis, the nucleus becomes smaller. It stains deeply basophilic. Whereas karyolexis, karyolysis, they represent the fragmentation and dissolution of the nucleus. And they are not seen in the necrotic cells in this pap smear. So what you are seeing here is a pycnosis, is what you should basically remember. A 68-year-old man with a long-standing angina pectoris with arterial hypertension, and the heart appears globoid. Now the question comes. In this heart, what do you see here? A hypertrophic cardiac muscle. There will be an intracellular accumulation of which component? It is the mRNA. The moment it became hypertrophic, Pradeep Reddy, Pavan Verma was guessing it as glycogen. No, it is mRNA in a hypertrophic heart. So, hypertrophic cardiomyocytes typically have more cytoplasm, larger nuclei, and there is an increase in mRNA, ribosomal RNA, and the protein. And why hypertrophy occurred? Because of the change in the transcriptional regulation will lead to development of hypertrophy. Now, a 34-year-old woman dies because of rabies. In addition to the direct viral cytotoxicity, the necrosis of the virally infected neurons. Who mediates that necrosis in the virally infected neurons? So you should remember both humoral and cellular immunity. Both of them are involved against the harmful effect of the viral infection is what you need to remember. Both these arms work together to eliminate the virus, infected cells by using apoptosis. Today, coronavirus you need to get rid of means lot of apoptosis should occur in the lungs. Right, doc? Now, in case of the rabies, the inflammation is centered in the brainstem and it also spills into cerebellum. Hypothalamus is what you need to remember. A 24-year-old woman contracts toxoplasmosis and delivers a 37 weeks gestation baby. What are you seeing in the imaging, doctor? You are seeing the presence of calcification. But where is this calcification occurring? This calcification is occurring into a damaged parenchyma of the brain. So that is the reason it is called dystrophic calcification, is what you need to remember. So what are all the situations where you see the presence of dystrophic calcification? Thrombi, especially in the veins. It undergo calcification that's called phlebolith. Hematomas, which are in the vicinity of the bones, they undergo dystrophic calcification. The dead parasites like hydatid cystosoma, X of cystosoma, cysticercosis, they undergo calcification. If you do mammography, a breast cancer shows calcification. Congenital toxoplasmosis involving the central nervous system can lead to development of dystrophic calcification, is what you have to basically remember. A 56-year-old woman loses her right kidney. right kidney. And the CT scan of the abdomen is showing her left kidney. How is the left kidney, doctor? It got enlarged. So this enlargement, is it a hyperplasia or is it a hypertrophy? Is the examiner's curious question. It is hypertrophy. Hypertrophy is a response to the trophic signals whenever the demand is increased. And what happens in hypertrophy, doctor? There is an increased expression of the proto-oncogenes. Mycogene, phosgene, racogene. Mycogene, phosgene, racogene. These growth promoting proto-oncogenes, there is an increased expression, is what you need to remember. A 34-year-old man with AIDS dementia complex develops acute pneumonia. He dies with respiratory insufficiency. And on autopsy, there is hydropic degeneration. How is the hydropic degeneration basically mediated? It is an altered plasma membrane sodium transport which will be responsible for the hydropic degeneration. So, whenever there is an acute reversible sublethal cell injury, acute reversible sublethal cell injury that lead to hydropic swelling. In hydropic swelling, there is a problem in the regulation of the volume of the cell, particularly sodium. It involves plasma membrane sodium pump, the supply of the ATP, etc., etc., etc. Now, a 70-year-old man has a profound bleeding from peptic ulcer. There's a hypovolemic shock and he dies because of the shock. And you have done the autopsy of the liver. So compared to viable hepatocytes, these necrotic cells contain higher intracellular concentration of which substance is the examiner's question. So there will be calcium. So what you are seeing is a centrilobular necrosis. The necrotic hepatocytes around the central vein, this is the central vein, around the central vein show the necrotic changes. When there is a circulatory failure, typically you find this kind of centrilobular necrosis. You have to differentiate it from the coagulative necrosis. Typically when coagulative necrosis occurs, then the necrosis will be away from the central vein. So this is a coagulative necrosis, but it is away from central vein. Centrilobular is around the central vein. Centrilobular typically occur whenever there is any ischemia, drugs, toxins typically lead to centrilobular necrosis. So it is the calcium which will go, intracellular calcium is the one which is increased. 62-year-old man is brought to emergency room. Bilirubin, AST, ALT, alkaline phosphatase, everything is elevated. You have done the biopsy. What can you see, doctor, on biopsy? You are able to see medullary bodies with the typical twisted rope appearance. Twisted rope appearance. And also there is a ballooning of the hepatocyte. Ballooning of the hepatocyte. So what does this medullary body basically contain? The medullary body contains intermediate filaments is what you should remember. So what do you mean by hyaline? Hyaline we say. What is hyaline? Any material that is reddish, homogeneous appearance, Whenever you stain it with hematoxylin and eosin is called hyaline. So, hyaline arteriosclerosis, alcoholic hyaline in the liver, hyaline membrane in the lungs, hyaline droplets, and this alcoholic hyaline, which is also called medullary bodies. They are composed of the cytoskeletal intermediate filaments, also called cytokeratins, is what you have to appreciate. Then what accumulates in the Parkinson's, doctor? Alpha-synuclein accumulates in the neurons of the substantia nigra in case of the Parkinson's. Compared to this side, how is this side? This side is atrophic. Atrophic. So this is a classical example of atrophy. Now, if there is a renal artery stenosis, if it has led to partial ischemia, over a period of time, what happens to the kidney because of this? Typically, it undergoes an atrophy. Renal atrophy is what you see whenever there is a renal artery stenosis. On the side where there is a renal artery stenosis, there is an atrophy. On the contralateral side where the renal artery is intact, there is a hypertrophy. So that's the point. A 70-year-old man is hospitalized suffering from mild stroke. The ECG is shown. What do you see in the ECG, doctor? You are able to see the presence of the ST segment elevation in the lateral leads. Lead 1, AVL. What are the lateral leads? Lead 1, AVL, V5, V6, they are all called lateral leads. So you are able to see the acute myocardial ischemia. Now the examiner's indirect question, two-step questions, these are all called. What type of necrosis do you see in the heart? Whenever there is an acute myocardial infarction, we see the presence of coagulative necrosis is what you need to basically remember. In the coagulative necrosis, there is a mitochondrial damage, release of cytochrome C into the cytosol, and that will do all the required dirty job of the necrosis once cytochrome C is released. 21-year-old man suffers from blunt trauma to the leg. 6 months later, there are bony trabeculae which are formed inside the skeletal muscle. What do you call this, doctor? Myositis. Myositis ossificans is the name given for it. It's an example of a metaplastic change. So it's also called osseous metaplasia. So metaplasia means one type of differentiated cell is converted into another type of differentiated cell only. The converted cell is also differentiated and the initial cell is also differentiated. That is metaplasia. Metaplasia versus dysplasia. Dysplasia is precancerous. There is necrosis in the myocardium of the patient. What is that histological feature that proves a definitive evidence that there is necrosis in myocardium of the patient? Nuclear fragmentation is a definitive evidence. So you should know very well, doctor, what are the various terms that you use. Pyknosis means shrinking and condensation of the nucleus. Pyknosis, shrinking. Karyorrhexis, rupture of the nuclear membrane. Karyolysis means it leads to basophilia, which gradually fades. So these are the classical features in case of the cell necrosis. So nuclear fragmentation is identified by karyorrhexis and karyolysis. It is the hallmark of coagulative necrosis is what you need to remember. Now, some of the options were given. Influx of lymphocytes. Influx of lymphocytes is the hallmark of chronic inflammation. Chronic inflammation. Whenever cancer grows, what is the programmed cell death to kill the cancer cells, doctor? How are the cancer cells eliminated? What is the programmed cell death? Who mediates that? It is the cytochrome C, which is an important mediator of apoptosis, is what you need to remember. Once more, doctor. If you come back to onlinembbs.com, you have something called MCQ practice. So once you come to MCQ practice, you have almost 3,000 lectures available. In this, topic-wise, the question bank is being classified. So in pathology, you have apoptosis available. So after this, what is the whole idea of our live online interactive sessions every day? To stimulate you, to give you that required petrol to go back to the onlinembbs.com and do the revision of that particular, you need to everyday discussion, you need to identify, okay, these are the 3-4 topics I want to improve, and you need to go back to the onlinembbs.com video library and do a revision, more extensive revision on all the questions asked in the last 15 years on the topic of apoptosis. Then if your satiety is not at full, then you can go to this 650 high yield topic. This is all quick theory revision. So in this, you have all the quick theory review. In this, once more, go to pathology, go to apoptosis. There will be 20 to 30 minute video lecture, PowerPoint, right? So take a chance to do the revision. Whatever you do, doctor, cat is black or white, I don't care. Catch the cat and show me. Who said that? A great communist leader, Mao. So, like the Mao said, you should also, it doesn't matter whether you read a book, whether you go through an app, or whether you go through a video library, whatever you do, you should get that required motivation, depth in the concepts, full understanding, your basics should be good, then nobody is going to stop you from cracking any licensing exam in the world. So, doctor, apoptosis, typically the mitochondrial membrane is the key regulator of apoptosis. When the mitochondrial pores open, the cytochrome C leaks out. It activates EPAF1. EPAF1 converts pro-caspase 9 into caspase 9. In turn, this caspase 9 will activate all the downstream caspases. Basically, all caspases are cysteine proteases. And these effector caspases cleave the target proteins, including endonucleases, nuclear proteins, cytoskeletal proteins. That's how the apoptosis is carried out. So the entire sequence of the apoptosis, what are pro-apoptotic, anti-apoptotic genes, Bax gene, BAD gene, all genes which are pro, which are anti. You have to be very sure on the concept of apoptosis. 84-year-old woman dies in her sleep. So lucky. At autopsy, hepatocytes are found to contain this kind of a golden yellow pigment, which does not stain with the Prussian blue. So in the elderly people, there is a lipofuscin, Lipofuscin is also called the wear and tear pigment is what you need to remember. So advanced age, lipofuscin accumulation is typically seen. So how do you describe the lipofuscin? It's a pale golden brown, finely granular pigment found in all the hepatocytes, also called lipochrome, lipofuscin, one and same. It is a wear and tear pigment. It is the accumulation of the autophagolysosomes over a period of time. It has no pathological importance. That's what you need to appreciate. A 19-year-old girl swallows a commercial solvent. A liver biopsy is showing necrosis around the central vein. So what is the mechanism that accounts for the reversible changes which are noted on this biopsy? It is the decreased store of the intracellular ATP is responsible for these changes. So what is that you are seeing, doctor, in this? There is a swelling. There is a swelling of centrilobular hepatocytes. So once there is a decreased intracellular ATP, that increases the permeability of the plasma membrane. That will damage the sodium potassium ATPase pump, which is the gatekeeper, which is digging and throwing out the electrolytes. Now what will happen? All electrolytes get accumulated inside the cell. Inside the cell it becomes osmotically active, it will suck the water and it becomes swollen. So it is a severe swelling of the centrilobular hepatocytes because of the decreased store of the intracellular ATP is what you need to remember. In a geriatric patient, the lipofuscin accumulation in the hepatocytes, what is the mechanism, is a very important question. It is the peroxidation of the membrane lipids. Fundamentally, lipofuscin formation, accumulation is all peroxidation of the membrane lipids. So the lipofuscin is found in lysosomes. It contains peroxidation products of the unsaturated fatty acids. And lipofuscin and lipoperoxidation. You have to remember these two buzzwords. 44-year-old man had a hypovolemic shock. He had been resuscitated. 6 hours later, he developed acute renal failure. Kidney biopsy is showing karyolysis of the renal tubular epithelial cells. What are the biochemical events that preceded these pathological changes? Typically, whenever a cell is deprived of oxygen, hypoxic damage is there. That leads to anaerobic metabolism to take off, that produce a lot of lactate, and that leads to decreased intracellular pH, which in turn will lead to the development of karyorexis and karyolysis, is what you should appreciate. A 64-year-old man with acute renal failure, he has got a very high blood pressure, 210 by 140. You have done the biopsy, in this case of malignant hypertension. So what are you supposed to discover? Typically, there will be fibrinoid necrosis. So this is a necrotizing arteriole in malignant hypertension where you find intraarteriolar thrombus and there is a development of this fibrinoid material, fibrinoid necrosis. So there is a pink fibrin typically will be forming around the vessel, which is called fibrinoid necrosis. A 48-year-old man presents with jaundice and hepatomegaly. You have done a Prussian blue staining of the liver biopsy. Intracellular iron storage protein is being found. What is this most likely to be? Jaundice, hepatomegaly, intracellular iron storage. Even on telephone, you should make a diagnosis of hemosiderosis. So it is hemosiderin. Hemosiderin is a partially denatured form of ferritin. It aggregates microscopically as a yellow-brown granule in the cytoplasm, and it turns blue with the Prussian blue reaction. Hemosiderin primarily deposits in the liver is what you need to appreciate. This child with progeria has inherited the mutations in the gene that codes for which intracellular protein? Very interesting question. Punctuate answers, doctor. Let me check how good you are able to think. Pradeep is saying helicase. Pradeep almost reached correct answer, but not the correct answer. Any other guesses? Werner's syndrome is helicase. But progeria, Manish Krishna is proposing topoisomerase. No. Laminin. Hutchison Gilford's progeria, this is called as. You might have seen the movie, no? Benjamin Buttons. Please, if you have not seen the movie, tonight only, you see it is available on the Netflix also. Benjamin Buttons. Brad Pitt, very good movie. It is all about a progeric individual. Even Amitabh Bachchan also has come up with a movie on progeria, no doctor? What is that movie called? It's lingering in my mind. What is that Amitabh Bachchan's movie on progeria? Manish Krishna rightly says Pa movie. So Pa movie is all about laminin. So they have a hair loss, atrophy of the skin, osteoporosis, early cataract, atherosclerosis, premature aging. It is the human lamin A gene mutation is what you need to remember. So what are laminins, doctor? They are the intermediate filament proteins. So that's what you should remember. A 64-year-old man with chronic cystitis had biopsy of the bladder mucosa that is showing the foci of glandular epithelium. Now, what do you like to call this as? Once more, this is an example of metaplasia. Transitional epithelium, which is a natural epithelium of the bladder, is converting into glandular epithelium because of the chronic inflammation in the bladder, which is an example of metaplasia, is what you need to remember. A 36-year-old woman develops Edisonian crisis, acute adrenal insufficiency. She developed postpartum hemorrhage. What is that called? Sheehan's syndrome. In Sheehan's syndrome, pituitary is not working. If the pituitary is not there, there is no ACTH. ACTH is the trophic hormone on the adrenal gland, suprarenal adrenal gland. If the ACTH is not there, the suprarenal adrenal will undergo atrophy because of the lack of trophic changes. That's what happened in this lady. A 64-year-old man has acute liver failure. He has undergone a liver transplant. The transplanted liver does not produce the bile for the first 4 days. There is a poor graft function. And it is considered to be because of the reperfusion injury. So what is the main mediator of reperfusion injury that lead to the development of the graft failure, doctor? It is the reactive oxygen species. So it's a common clinical problem whether you take myocardial infarction. In myocardial infarction, the moment you open up that occluded coronary vessel, then there will be reactive oxygen species, free radicals will go and damage the myocardium. Similarly, infection can produce reactive free radicals, transplantation, shock, etc., etc. The moment there is a re-establishment of the perfusion, that lead to the sudden release of the free radical species, which lead to reactive oxygen species, and they lead to the damage. A 52-year-old man with a history of heavy smoking, a coin lesion is being found, bronchoscopy and biopsy, there is no mass, but the bronchial mucosa is showing squamous metaplasia. So what is the prognosis of this metaplastic change? So if he stops smoking, at least now, after this metaplasia, there is a chance of reversion to normal. So that is at least a good news. So metaplasia is an adaptive mechanism. Unlike dysplasia, which is not reversible, metaplasia is still reversible. That is a point you need to appreciate. A 72-year-old woman with a history of hyperlipidemia dies because of cardiac arrhythmia with a massive heart attack. Hyperlipidemia developed cardiac arrhythmias. So, peroxidation of which molecules in her is primarily responsible for the loss of the membrane integrity leading to this arrhythmias? It is the phospholipids. Phospholipids. So during lipid peroxidation, hydroxyl radicals, they remove the hydrogen atom from the unsaturated fatty acids of the membrane phospholipids. And these lipid radicals react with the molecular oxygen, form lipid peroxide radical. And this lipid peroxide is unstable and break down into smaller molecules. And typically that is responsible for all the damage, is what you should appreciate. A 64-year-old presents with multiple patches of discoloration of his face. Biopsy of that lesional skin had been done. So what are you able to see in this histology? Looking at this histology, what is your diagnosis, doctor? So these are all atypical keratinocytes in the epidermis. And this is actinitic elastosis with a lot of inflammatory infiltrate in the dermis. So it is an example of actinitic keratosis is what you have to fundamentally remember. So atypical squamous cells, dysplasia in a actinitic keratosis is what is being shown. A 22-year-old construction worker had a sharp rusty nail and he developed a deeply located pus pocket. So a pus or an abscess, fundamentally what type of necrosis it is? It is a liquefactive necrosis is what you need to appreciate. So a lot of acid hydrolysis become released by the polymorphonuclear leukocytes. They lead to digestion of the dead cells and lead to the development of this abscess formation is what you need to understand. Now, in a renal cell carcinoma, there is an increased hematocrit. Why? Because renal cell carcinoma produce erythropoietin. Erythropoietin acts on the bone marrow and lead to erythroid cell hyperplasia is what you should appreciate. A 44-year-old man undergoes a liver biopsy. He has hepatitis C infection. The cellular processes that account for all this acidophilic bodies in the liver biopsy, what are they? They are the apoptotic bodies because of the cell death. So, whenever viral hepatitis is there, there's an extensive necrosis and a large pink cell with ballooning degeneration. That's what you're able to see. Large pink cell with ballooning degeneration. And there is a shrinkage leading to eosinophilic councilmen bodies. So these are the councilmen bodies and these are the hepatocytes with ballooning degeneration. That's what you are able to see. Right? The councilmen bodies. This is the ballooning degeneration, the councilmen bodies. And typically, these acidophilic councilmen bodies are those apoptotic bodies in viral hepatitis is what you should appreciate. A 36-year-old woman with abnormal cervical pap smear. And the cervical biopsy, what you are able to see, doctor, there is a lack of polarity. There is a loss of polarity, which is the marker of dysplasia. Dysplasia, which is deranged cell growth, which is classical of the pre-malignant condition is what you should appreciate. Acidophilic bodies. What are the biochemical changes that you see in the formation of the acidophilic bodies in that patient? It is the fragmentation of the DNA, which is typically responsible. So, fragmentation of the DNA is a common thing that you see in both necrosis and apoptosis. But apoptosis typically will show nucleosomal laddering. This is called nucleosomal laddering, which is the classical feature that is seen in only apoptosis but not in necrosis, is what you should appreciate. A 32-year-old woman attempts suicide by taking carbon tetrachloride in the laboratory and develops acutely liver failure. So what is that cellular protein which is involved in the development of hepatotoxicity in this patient? It is the mixed function oxygenase which is responsible. So typically the solvent carbon tetrachloride is metabolized by the mixed function oxygenase to chloride ion, which is highly reactive, and this radical is a potent initiator of lipid peroxidation, which damages the cell membrane, and that leads to development of the cell death is what you should appreciate. So that is the story, doctor. Be happy, don't worry, coronavirus is going to go away, right? So, thank you all for taking participation in this marathon, and please be part of our Telegram group, WhatsApp study group, and also go to the onlinembbs.com and also please promote it in your WhatsApp study groups and your friends groups. Our students are our best brand ambassador. Please ask your friends to visit www.onlinembbs.com and also fill the form in the homepage and download the PDF. Every day we will be uploading a lot of free notes, etc., etc. You can take an opportunity to download the PDF every day and let us study together every day and become better every day. And in the next 18 days of lockdown, let us take the opportunity in every adversity and rise above the echelon. So that is a whole idea. And this is the best time. Once more, life becomes very busy after April 14th, running around the hospital, residency, internship, this and that. So this is the best time we all can study together. Thank you very much. See you all tomorrow once more.